3 weeks ago, Max was running again. Today, he won't even get up for dinner. If this sounds familiar, you're not alone. And no, your vet didn't prescribe the wrong medication. The problem is that pain medications were never designed to heal your dog. They were designed to buy you time. Let me show you what's actually in those bottles and, more importantly, what they're not doing. After 2 decades as a pharmacist and studying public health at doctorate level, I started paying attention to a pattern in pain management, and what I found changed everything. The first type of pain medication you will encounter for your dog are NSAIDs like Loxicom, Metacam, and Carprofen. These are your inflammation fighters. They block specific enzymes called COX-1 and COX-2 that trigger swelling in joints and tissues. Second are neuropathic medications like Gabapentin and Amantadine, which calm overactive nerves, sending false alarm signals. Third class of pain meds are opioid-type drugs like Tramadol or Pardale-V. These change how your dog's brain perceives pain. Here's what most pet parents don't realize. Each medication only addresses one pathway in a complex pain system. It's like turning down one instrument in an orchestra, but the music, pain, is still playing. Think of chronic pain like a fire alarm system in a building. NSAIDs turn off the smoke detectors in the rooms where the fire started. That is your dog's inflamed joints and tissues. Effective, but only if that's where all the smoke is coming from, which is not the case. Gabapentin cuts the wiring to alarms that keep ringing even when there's no fire. That is the phantom nerve signals from old injuries or compressed nerves along the spine. Amantadine targets the central control panel where the alarm system has become hypersensitive. This is because over time, chronic pain literally rewires your dog's spinal cord to overreact to normal signals. Tramadol and Pardale-V work in the security office that is your dog's brain. They change how threatening the alarm sounds in the first place. This means it dampens the perception of pain. The alarm still rings, but the volume is turned down. But here's the critical part. These meds don't fix the structure or system that broke down in the first place. That is the inflamed joint. Instead, they convince the brain that the noise isn't as urgent or dangerous. So why does your dog seem better for 2 to 3 weeks, then the limp comes back? Because medication creates a pain-free window, but most dogs use that window to do less, not more. When your dog moves less, leading to muscles atrophy or muscle wastage, losing up to 40% of mass in just 3 weeks. Second, fascia tightens. That connective tissue becomes like shrink wrap around joints. Third, circulation drops. Less blood flow means less oxygen, less healing. Fourth, proprioception fades. Your dog literally forgets where their leg is in space. The medication is still blocking the pain signals, but underneath the physical foundation is crumbling. That's why when dogs stay on the same dose, pain seems to break through. The body just has less to work with. The missing piece isn't in your medicine cabinet, it's in your dog's dermal and musculoskeletal support system. This is where we bridge pharmaceutical pain control with physical restoration. Targeted movement therapy that is gentle, progressive exercises that rebuild muscle memory without triggering flare-ups. Topical pain relief support. Topical botanical formulations delivering circulation-boosting compounds where they're needed most. This is great for dogs with compromised kidney or liver function. Myofascial support through massage and botanical ingredients that work through the skin to help ease fascial restrictions and support tissue mobility, which in turn support those unstable joints and reduce pain. Medications buy you a window. What you do in that window determines everything. This isn't about replacing your vet's treatment plan. It's about completing it. The difference between symptom management and actual recovery. As a veterinary pharmacist with a doctorate in public health, I've seen thousands of prescriptions come through, and here's what I know. Every dog on long-term pain medication needs movement recovery plan, not eventually, now. In our next video, I'm going to walk you through the side effects veterinarians watch for. With these medications, the early warning signs that appear before blood work shows problems, and the conversations you should have with your vet before they become urgent. Because managing pain isn't just about today's comfort. It's about protecting your dog's quality of life for every day you have left together. Subscribe if you want to be the kind of dog parent who understands what's really happening and knows what to do about it.